Welcome back to Inspire Great Health, your local trusted healthcare podcast. Today we're going to be talking about mobile integrated health, and I have some guests with me who are going to help me explain what that is. So, Jared, Cindy, welcome.
Thank you. Glad to be here.
Happy to have you. So go ahead and introduce yourselves and tell me a little bit about what you do here at Cheyenne Regional.
Sure. My name is Jared Skagen. I am a nurse here at Cheyenne Regional. I oversee a number of different departments. One of them being Mobile Integrated Health with Cindy.
And I'm Cindy Osborne. I am an AEMT and also a certified community paramedic. And I oversee Mobile Integrated Health and Transport for CRMC.
All right, so we'll jump right into that. What is Mobile Integrated Health?
Mobile Integrated Health is our community paramedics go out into the home and assist patients with home safety assessments. They do medication inventories. We help them coordinate appointments. We're able to do some on-site care like EKGs. We can do blood draws. We can do infusions.
So what types of patients does this support?
Oh, all types. Initially, we started out with a bunch of cardiology patients, and we've since moved into respiratory, wound care, diabetes, cancer center patients. So it's just whoever gets a referral to us.
What's the goal of the program?
I think as we, Mobile Integrated Health being like a different way to deliver healthcare. Our goals were really, one, to support our community needs and to support our organizational goals. So as a community, we recognize that sometimes having a lack of access to care can be a big barrier for people to being able to have appropriate follow-ups, appropriate prevention methods, all of those types of things. And as a goal, we continue to want to support our community so that they don't have readmissions back to the hospital, so that they can come get the services they need and be set up to be able to stay back at home. And so that has been one of our big areas of focus is, one, ensuring that patients are able to connect to the right resources at the right time. So a lot of our visits include real-time or communication with the providers, their specialty providers or their primary care providers. So allowing that link to the provider and patient in real time has proven to be very effective in addressing concerns as they come up. And also then that close monitoring of patients after a discharge from a hospital, where it can be difficult sometimes to get into an appointment right away, allowing someone with eyes on the patient to be able to assess them, making sure they're taking their medication appropriately, following their plan of care appropriately, and have all of the resources they need to allow them to get to the next step of prevention has been a really big benefit.
How is this program funded? How did this program come about at Cheyenne Regional?
Community paramedicine, I would say, is something that was really started becoming a thing over the last decade in a very small way, and it progressed a little bit during COVID and the pandemic as the need for more types of virtual care, reimagined care came about. And so you saw ambulance services having these types of programs and then being able to provide vaccines for patients at homes and different levels of service like that. And for an EMS service, the benefit is that you can go out and evaluate a patient at their home if they've called 911 for emergency services, and then evaluate that patient and say, do you need hospital transport, or are there things that I can do for you right here in this home to help you stay here instead of taking you to the emergency department and needing those services. As we looked at, Cindy, being an expert in all things EMS, brought this to the organization. We said, how can we make this work where we have these specially trained paramedics who not only have the ability to assess acute problems and deal with acute things, but also this additional training of more primary care and a more holistic approach to the patient, which normal paramedic level education doesn't provide. How can we use these individuals that have this training and make this work within our system as a hospital-based program and for our community, right? So we looked at what it was, what the scope could be, and we initially were funded through a grant through the Department of Health, the State of Wyoming Department of Health, that we applied for and received, and that allowed us to make some of our big purchases for equipment and things to get up and running. And then since that time, grant funds have ceased, but we've been supported operationally with our organization just because of the impact that we've had with our patients. We've also been supported through the Population Health Department within our organization with some supplemental grants throughout the last couple of years, which have been very great to help with staffing and things.
How have you seen a shift in the community, if you have seen a shift in the community with this program?
I don't know if we've seen like a major shift yet. I think there are signs of that happening. Some of the great work that Cindy and the team have done is working with our community partners. So with HealthWorks, for example, we've seen them become very engaged and wanting to not only get referrals for primary care, which allows those patients that they're a safety net for our community, right? So being able to connect those patients when they need a primary care with that community partner has been instrumental in helping people have access to care. We're also seeing other outside services and providers put in referrals and call and ask about their patients and can we go see their patients. So we've had even the UC Health Primary Clinic reach out and ask if we can go see their patients and what we can do. So we're seeing, I think, is that there's a real great need for these types of things where patients need closer monitoring than just a routine primary appointment. Their providers are concerned about their patients in between those primary care or specialty care appointments, and that there's oftentimes things that need to be done that just aren't able to be recognized if someone's not in the home talking with that patient on a regular basis in between those appointments.
Those are all the questions I have. Is there anything else you'd like to add?
I did bring you my infographic that you guys helped us with. Put it in my pocket because I didn't know what your questions were. So. We had a stellar first year with Mobile Integrated Health. And I'm just going to read off some of our numbers because I don't have them memorized as of today. But
Well, why not?
well, if you would have asked me 2 weeks ago, I had them memorized, but I had a little vacation since then, so things have changed. So we had 947 visits within the community for 95 patients that we enrolled in 2025. 80 of those patients came to us by referral. We've had 35 program graduates, and what that means is that they have been able to take care of their own health, and they have completed all the goals that we set for them on our initial visit. We have 42 current patients, and we spent 63,429 minutes serving those patients. So we've had a pretty good start.
Yeah.
And that's with 3 full-time employees. So,
Wow. So a lot of hard work goes into this program.
yes.
Yes. From a very small group. Well, it sounds like you guys are doing amazing work, so thank you for all that you do for our community. Thank you again, Jared and Cindy. I appreciate you joining me today. And thank you for tuning in, and be sure to tune in again next time.